Welcome to our webinar, Ayurveda for Female Health, where we will talk about a very important time for every female, the transition of the female to menopause. Before we jump into our topic, I'd like to introduce myself. My name is Julia Michaela Pomaskina, and I'm an Ayurvedic practitioner and herbalist practicing in Sydney. I first came across Ayurveda in 2006 when I was traveling in India. And since then, I've extensively studied and practiced it with myself and my patients. And I have completed the Advanced Diploma of Ayurvedic Medicine in Australasian Association of Institute of Ayurvedic Studies. I have also studied Ayurveda in India, in Australia, with the Russian doctor Boris Rogozin, a well-renowned Ayurvedic doctor, with the Russian Ayurvedic practitioner Roman Igoshin, and one of my personal favorites, the world-renowned Ayurvedic doctor and an expert in female health, Dr. Claudia Welsh. So in this webinar now, I will attempt to give you the full picture of my theoretical base in Ayurveda, as well as my practical experience with myself and my patients. And a few things about Ayurveda as well before we start. Some of you could be familiar with what Ayurveda is and what it does. And for some of you, this is the word that you don't hear very often. So what is Ayurveda? Ayurveda originated in India, although I personally firmly believe that it does not belong to India only. It's actually a system for health, longevity, and living in harmony with the laws of nature that's applicable to the whole of humanity. Ayurveda is believed to be originally given to humans by the creator god Brahma, and then the sun god Indra had a part in it as well. And this knowledge was handed over to sages, rishis, and saints of the time, many thousand years ago. And first it was an oral tradition, and then they have recorded it in the form of shlokas, researched it, added to it, classified herbs, diseases, etc., etc. So originally, Ayurveda was practiced as a complete medical system, complete medical science, and it had branches like surgery, pediatrics, even aphrodisiacs, rejuvenation, and many others. Nowadays, of course, we practice Ayurveda for two purposes. So Ayurveda has two goals: to maintain health and to alleviate the suffering and disease. So now we practice Ayurveda through, we call it complementary medicine nowadays, and we practice it as dietary and lifestyle modifications and herbal medicine as well. So now let's go into the topic of today's discussion, menopause. So every woman that lives beyond the age of 40 will go through this huge transition for a female. And for many women in the West, it turns out to be a very turbulent, a very vulnerable transition with many physical, psychological, emotional, and mental symptoms. And for many women in the East, it's not. For many women in the East, it's not such a huge thing. For many women in the East, the periods just gradually stop and there are not that many symptoms, right? Why is that? There is a lot of both Ayurvedic and modern scientific research saying that the menopause experience largely reflects the societal and cultural beliefs of the society. So if our society is youth and beauty oriented and the female perceives that she is losing that through menopause or grieves the loss of fertility, then of course it's going to be a very turbulent experience. If in other societies and cultures, the wisdom, female wisdom is valued more than youth, then of course it's a totally different experience for females. So it's not one experience for all. There is a variety of backgrounds, lifestyles, genomes that impact on the menopausal experience of women. In Ayurveda, the menopause is called the Great Unveiler. And later on, we will touch on that in great detail and we'll understand why. So what do we want the menopausal years to be? The years of turbulence, or the years of new opportunity, and to have a look at ourselves and our lives in a new way and redefine who we are, redefine what role all the women play in the society as well. So that's right. So we will break this webinar into two parts. The first part will be mainly theory. So just bear with me while we go through that, and it will be necessary for us to go through some Ayurvedic concepts so that you understand better why and what we're going to be talking about later on, right? So the second part will be specifically Ayurvedic protocols for menopause, which you can apply also, an important note as well is that although this webinar is focusing on the menopause, it's very useful. I'm just getting a message that my internet connection is unstable. So if you can't hear me for any reason, just put in your chat notes, or if it cuts off, then I'll jump back in as well and you will get the recording anyway. So hopefully, fingers crossed, the internet will be okay. You know, it's the evening and everybody's jumping on the internet now, so who knows. So the second part of our talk will be about specific Ayurvedic regimes and recommendations for the period of menopause. But it's also important to note that it's not just menopause that we're talking about. We're talking about female health in general, right? As above, so below. As we lived through the first half of life, so will be reflected in our second half of life. So this webinar is actually very useful for all females, especially the females that are going through the perimenopause right now, and menopausal and postmenopausal times as well. So now let's come to the Western view, not the Western, more anatomical and physiological view of the hormones and what's happening at the female cycle. So this is a bit of a rehash. So the female cycle is broken into three phases. The follicular phase, when the follicle is being formed, then ovulation phase, when the ovulation happens, and the luteal phase, when the follicle, the luteal phase, when the follicle is broken down into corpus luteum, and this luteal phase is dominated by progesterone. The follicular phase is dominated by estrogen that's stimulated by FSH. FSH is follicular stimulating hormone. And it's important for us to note that FSH, the follicular stimulating hormone, and the luteinizing hormone, LH, are actually commanded by our hypothalamus and pituitary glands located in our head. So it will be important later on when we talk about the ways to manage menopause. So our hypothalamus and pituitary gland command the release of FSH. FSH stimulates the formation of the follicle during the follicular phase, after the menstruation, after the menses. The estrogen rises, and the surge in the luteinizing hormone causes the follicle to break, to rupture, and the corpus luteum comes out, and then the progesterone phase starts. So that's the normal menstrual cycle. what happens in the later years is that this hormone cycle starts being disrupted. FSH and luteinizing hormone don't function as they did before, and their level fluctuates and rises, and that causes our estrogen and progesterone levels to decline over time, subsequently leading to a lot of uncomfortable symptoms. A couple of points here. Our estrogen and progesterone during menopause right, I'm just getting some messages. Can you, so you guys having trouble hearing me? Okay. So can you hear me now? Or is it bad? I can turn my video off, but leave the slides on if it helps. Okay, so if you can't hear me, just type a message and we'll see what we can do. I might need to put the earphones on. Yeah, great, because of the internet instability. I don't know how much you can do about that, but if you can hear me, if you're having problems, just type it in, right? So we were talking about the over time decline in estrogen and progesterone. However, it's important to note and bring the function of the liver into the conversation here. So, and again, that will be important later on. So talking about female livers are actually working very, very hard during the cycle. So due to monthly cycles, there is a lot of hormones, as you can see, that are moving. There's also others, cortisol, testosterone, and many others that are moving from a state of predominance, and then they need to be quickly taken out of circulation by the liver in a very compressed period of time. So hormones are moving through peaks and troughs in a very concentrated time frame, and female liver is generally very, very busy. So our livers are the primary site of both metabolism of sex hormones and metabolism of stress hormones. So it's important to note that, take a mental note of that, and we'll talk about it later on. So liver health in terms of hormonal metabolism is paramount. And the last thing that I'd like to mention on this slide is that over time in menopause, progesterone and estrogen actually don't go out. I keep getting messages that people can't hear me. Okay, let me turn my video off for a while. I can't actually do that. It's frozen again. Okay. If it freezes, then it might come back. Let me see whether I can put the earphones on, but I don't think it will make much difference. I think it might go through waves when it's a bit fainter, and then it will come back again. So can you hear me now? Okay, great. So back to the slide. So we were talking about that estrogen and progesterone don't actually completely disappear from the female body, and the decline is about 40 to 60% only. So then again, that's important information for us later on. Okay, So nosing on. Now, stages and symptoms of the menopause. So the menopausal period generally is broken down into 3 stages. The first one, perimenopause, it typically begins 2, 3 to 5 years before the menopause. Sometimes it is 10 to 12 years prior to the menopause. That is happening more and more often now, unfortunately. In my personal clinical experience, a lot of women, most women don't actually think or realize that they're in the perimenopausal period until the symptoms hit and until the menopause starts. It would be wise for all of us to be more tuned to our bodies. The menopausal period itself, the menopause itself is from the cessation of the last period for 12 months, and post-menopause starts at 12 months after the last menstruation. Right? So natural menopause time frame age group for women is between 45 to 55, and some women even later. Early menopause is considered to be the age of 45 years old, and premature menopause before 40. And now, unfortunately, we're seeing more and more women with early menopause and premature menopause. And it's happening more often. The symptoms of menopause for women can be very uncomfortable, and they can start at the perimenopausal period. And they include also hot flushes, irregular periods, either very scanty periods or a lot of bleeding, aggravation of fibroids, mood swings, night sweats, low libido, skin problems, joint pain later on, muscle tension, you name it, anxiety. So the full Monty, but it doesn't have to be. So the allopathic or modern medicine approach to menopause. So before we talk about that, I would like to make this comment. I prefer to think of modern allopathic medicine and complementary medicine working side by side together. Nothing is purely good or bad. And we want to take the best of both worlds. We don't want to be the person who goes natural medicine only and then misses vital clues or signs or tests going to the doctor. But we don't want to follow the allopathic approach only. We want the best of both worlds. We want to take the best care of ourselves. So with regards to hormonal replacement therapy, for example, bone density therapy, yes, there are a lot of side effects that have been well researched and documented. But everything has risk and benefit to it. So if the symptoms are so severe that no diet, lifestyle, herbs work, then some women get even suicidal during menopause. Is it worth taking the allopathic approach? Of course. But we want to be well informed and we want to be aware of the risk factors and weigh them with the benefits as well. So the hormone replacement therapy or menopause hormonal therapy involves either synthetic or bioidentical estrogen and progesterone. And there seems to be conflict with regards to the side effects and efficacy of these treatments. Do they work? Absolutely. Do they include side effects? Yes, they do. And the side effects might include things like side effects actually include high risk of breast cancer, higher risk of blood clotting and strokes, for example. As I said, there's conflicting research being released. I just got a message, menopause and postmenopause say they both started 12 months after the last period. Menopause is 12 months after the last menstruation, the period from the last menstruation for 12 months. And postmenopause starts at 12 months after the last menstruation. I hope I explained it. So the first 12 months after the period is menopause, and onwards is postmenopause. So hormonal replacement therapy. So we were talking about the side effects. Yes, there are quite a few. but again, you work with your doctor, you weigh out the risks and benefits, and regulate the dose in the correct way, and they work absolutely. However, there's no much use in hormonal replacement therapy if you haven't managed your stress levels, if you, for example, have estrogen dominance, and your liver doesn't metabolize estrogen well, and your problems are caused by stress hormones, then hormonal replacement therapy might not be necessarily a great thing for you. Another allopathic therapy for loss of bone density is bisphosphonates, and there's modern types that include monoclonal antibodies, and a lot of other new treatments are being researched. Again, they have, do they stop or slow down the breakdown of bones? Yes, they do. Do they have side effects? Of course they do. So just something to be aware of. Non-hormonal medicine is also antidepressants. It's interesting that epilepsy drugs have been used and showed some interesting results in treating hot flushes, as well as antihistamines. Dietary and lifestyle changes are recommended as well as calcium, vitamin D, and magnesium intake, and of course, psychological treatments, counseling, and cognitive behavioral therapy. So that's what's offered to us by the modern medicine, which is quite an impressive package. And let's have a look now at what Ayurveda offers us in terms of managing menopause. So Ayurvedic view of menopause starts with female health and female menses, actually. Ayurveda firmly holds that that female menstruation serves as a cleanup for our body. It renews our body, and it's our natural balancing and healing mechanism. It removes accumulated toxicity and accumulated doshas, and we'll talk later about doshas. And so much so that menstruation is called natural rakta mokshana in Ayurveda, or blood purification. Oops. So what are you? The force that's most active during menstruation is a downward force of vata, apana vata, and it's very important not to disrupt the downward force. The downward force is disrupted by activities like exercise, sexual activity during menstruation that Ayurveda doesn't recommend, by being active out there in the world. The energy can flow in the right way downwards, and in some way it can contribute to and get stuck and changes. So Ayurveda holds that it's balanced doshas or bodily energies and no toxicity. That's the key for the menopausal and postmenopausal women, as Ayurveda doesn't look at them as Ayurveda doesn't look at the estrogens in the same way the modern medicine. So Ayurveda does recognize the, I'm getting again a message that my internet's unstable. That's, oops. So Ayurveda does recognize the role of hormones. However, Ayurveda firmly holds that if a female has led an unbalanced lifestyle, that before the menopause, for the last 15, 20, 30 years prior to the menopause, then that would lead to problems in the menopause. That it's not largely hormonal deficiency that causes problems, but excessive accumulation of stress hormones and production of toxicity in the bodily tissues that later on leads to symptoms and problems, right? So that's an Ayurvedic approach. We'll go any further. It's important for us to understand. So I mentioned doshas when we talked about Ayurveda. It's important for us to have a brief understanding of what doshas actually are. So dosha, from an Ayurvedic point of view, is an energy that governs the body. Ayurveda is an elemental science that holds that the whole universe, manifested universe, including humans and our bodies, is made up of the 5 elements, and the 5 elements are being ether, air, fire, water, and earth. And then these elements organize themselves into bodily intelligences in our bodies called doshas. So you can think of doshas as the energies, or you can think of doshas sometimes being translated from Sanskrit of that which spoils. So the more when the doshas are in balance, they give us good health, good physical, emotional, mental health. When the doshas go out of balance, the problems start. So it's important for us to go through a bit of Ayurvedic theory to understand the concept of doshas. There are 3 doshas in Ayurveda: Vata, Pitta, Kapha. Some of you already know a lot about them, but I'll reiterate anyway. So Vata dosha. Vata is like a conductor of the orchestra. It's the most mobile dosha. It governs movement. It governs breathing. It governs heart impulses. It expands and it constricts. And it also governs conduction of neurotransmitters. You might recognize, as we talk about Vata, Pitta, Kapha, I don't want you to think of the what constitution am I? Am I Vata, Pitta, or Kapha? But I want you to see how these energies present in your own body or mind or emotions as well. So most likely you will identify with some of the Vata and some of the Pitta and some of the Kapha symptoms. Just take a note of that, right? So the gifts of Vata energy are creativity, quick thinking, love for traveling, communication, making friends very quickly. And the downside of Vata is that emotionally, Vata energy is prone to fear, anxiety, pains. It can be very spasmodic. Typical Vata person can feel very lonely, and they need warmth, loving relationships to get them out of that state. Vata women can feel very unprotected in life, unstable, starting a lot of projects but not finishing them, being ungrown. Good thinking eventually leads to overthinking, stress, anxiety, those types of things. Physically, Vata energy in the body is located in large intestine, pelvis, bones, thighs, and ears. And of course, talking about pelvis, I'm talking about bones. This is the area of the female reproductive system that holds the female reproductive system. So let's take a note of that, because Vata is managing Vata is very important for healthy reproductive system and healthy menopause. Also take a note that bones and our skeletal structure is managed by the force of Vata as well. The qualities of Vata dosha are dry, light, and cold. Women with excessive Vata dosha, for example, will have tendency to dry skin, dryness of hair, dryness of stool, pellets or constipation, light bones, light sleep, scanty menstruations, premature menopause. Extreme excess of Vata will definitely influence and cause premature menopause, and anxious nervous system. So Vata women are very light. Even if they're overweight, there will be lightness of bones and muscles. They're very quick communicators, they're lively, they're talkative, and there's a tendency to malabsorption and weight loss as well. And the coldness can manifest as cold hands or feet, weak circulation, broken capillaries, weak joints, and the need for warm food and relationships. So now the next force is Pitta, the energy. So Pitta energy is fire and is comprised of the fire and water elements. And the water in this instance is actually not water, but oil. Oil and fire go together. So Pitta wants to transform. Pitta is born to transform. Pitta governs digestion, which means transformation of food into us, metabolism, body temperature, and cell nutrition. The gifts of Pitta are high intellect, which sometimes tears, transformation, ambition, responsibility. Emotionally, Pitta women can be prone to anger. Oops. So emotionally, Pitta women can be prone to anger, irritability, rage, hate, jealousy, competitiveness, right? So Pitta is located in the small intestine, liver, gallbladder, pancreas, are all Pitta organs, lower part of stomach, sweat glands, blood, eyes, and skin. So already look at the energies of Vata and Pitta. We can see how these two energies are at play big time during the perimenopausal and menopausal time. The qualities of Pitta dosha are oily, sharp, light, and hot. So Pitta women will have soft skin, shiny, penetrating, sharp eyes, abundant sweat. If Vata people don't sweat very well, Pitta women will have abundant sweat, and they will have a very selective affection for certain people only. Pitta women have attention to detail, good fast digestion, good appetite, good memory. They're very alert, ambitious, goal-oriented. They want to transform the whole world. They're very responsible, demanding. There is tendency to control others and suppress emotions, and to be abrupt sometimes because they're so goal-orientated. The body temperature tends to be hot, as well as the temperament. Pitta women are prone to premature hair graying. If hair loss is more of a Vata quality, hair graying, premature hair graying is more of a Pitta quality. They overheat very easily, particularly in hot climates and sweat a lot. And the sweat can be sometimes very unpleasant. Pitta women have abundant menstruation and bleeding and tendency to lose stools. And lastly, the last dosha is Kapha dosha, which is the energy of earth and water. So if Vata energy is catabolic, it breaks down. Pitta energy transforms. Kapha energy is actually anabolic. It builds up. It holds everything together. It gives structure and stability to our body. It is responsible for such functions as moisturizing and lubrication, for example, lubrication of joints, lubrication of our mucous membranes, lungs, heart, pericardium. It promotes healing of the wounds, and it promotes fullness and lustrousness of the body. The gifts of Kapha are good immunity and good longevity, good energy. Kapha women tend to be very nurturing, caring, peaceful, forgiving, loving, and looking after the family. And emotionally, the downsides are Kapha women can be very attached. There is a tendency to greed, addiction, depression, lethargy. Kapha physically in the body, physiologically, is located in the lungs, chest, throat, head and sinuses, as well as in the upper part of stomach and in the joints and plasma. The qualities of Kapha are oily, heavy, and cold. So even if Kapha woman is not overweight, Kapha is usually associated with being overweight, but this is Ayurvedically, it's not necessarily correct, right? So Kapha women can be very trim as well, but the body will always be heavy. The bones will be heavy. The muscles will be heavy as compared to Vata women. So Kapha being a lubricating dosha also gives a gift of healthy joints, lustrous hair, sometimes oily, equal distribution of fat in the body. It's interesting that Ayurveda tells us that Vata women accumulate fat around their thighs and in the lower part of the torso. Pitta people accumulate fat around the stomach and the middle part of the torso. And Kapha people have equal distribution of fat in the body mostly, or sometimes more fat around the lung area. Kapha people are prone to excess mucus, and emotions can be very people in situations. And strong attachments can weight gain easily. The reason for that is often endocrine imbalances, can be slow digestion, slow thought, slow metabolism. And the dosha being cold, they tend to get colds and flus and cold extremities quite frequently. So it's important for us to know the differentiation between Vata, Pitta, and Kapha as we move on, because now we're going to talk about the stages of life. So Ayurveda classifies pretty much everything into Vata, Pitta, and Kapha energies, and it is applicable to you. It is the qualities that manifest in your mind, physical, emotional, mental constitution right now. But also Ayurveda classifies seasons, and Ayurveda classifies stages of life as Kapha, Pitta, or Vata dominant. And Ayurveda calls childhood a Kapha dominant phase. So you know how we spoke about Kapha being catabolic, Kapha being building, mucousy, juicy, the juices are flowing. So Kapha phase is from childhood to puberty, from birth to puberty. It's nourishing, building, and very often young kids have a lot of mucus around their nose and all that sort of, and colds, flus, and that's kind of normal because they're in the Kapha phase. And then when the hormones kick in, a woman transitions into the Pitta dominant phase of life. And the Pitta dominant phase of life will be driven by achieving, being out in the world, working, accumulating wealth, executing, acquiring, accomplishing things, giving birth to children and bringing up family. So that's a Pitta dominant phase. But once the hormones start to slow down, the woman enters into the Vata dominant phase, which in Ayurveda is called the retirement phase, the phase of letting go, introspection, the phase of moving into being the wisdom holder for the community and for the society, turning to inner wisdom, evaluating wisdom gained through experience. And it's very important for a woman at that phase to reduce the work hours, to go within, to rest, to start holding the energy for family and community, to look after herself and explore the new understanding of herself and her life. According to Ayurveda, it is the Vata phase that is the wisdom years of the woman. So if the Kapha dominant phase, if we talk about the body, mind, and spirit, we can break it down like so. The Kapha dominant phase is when the body grows and the focus is on the body. The Pitta dominant phase is the mind. The mind is active, achieving and doing things in the world. And the Vata dominant phase, the healthy characteristic of a Vata dominant phase for a woman should be the spirit, going within, looking for the gifts within and giving them back to the community. And from here, we can see that the transition between the Pitta phase and the Vata phase, so any transition is already Vata aggravating, is aggravating for the nervous system. It's a time of upheaval, a time of step to the unknown, getting up, the old concepts of self. How many women say at menopause, I'm no longer what I used to be? And that is very true, because the cusp of transition from Pitta to Vata does bring a lot of instability. And the main doshas at play here would be Pitta and Vata. Now, the symptoms, according to Ayurveda, the menopausal and perimenopausal symptoms can also be classified as Vata, Pitta, and Kapha symptoms. The Vata symptoms would include emotional anxiety, fear, fatigue, mood swings, also reduced bleeding, scanty short periods, so progressively in perimenopause with Vata dominant energies for a woman. Progressively in perimenopause, the periods, the cycle becomes shorter and shorter and shorter, and the bleeding becomes smaller and smaller and smaller, say from 5 days to 4 days to 3 days to 2 days, and the periods become very scanty. That's a very Vata symptom. And the cycles become shorter, shorter, and shorter. When we were looking at the Vata energy above, we talked that Vata governs the bones. So the joint and bone issues, osteopenia, osteoporosis, and all those types of disorders would naturally fall under Vata and would be exacerbated in the body when Vata dosha is increased. Vata being dry causes dryness of skin, hair, and unfortunately vaginal dryness as well in some women. So we'll talk later about that. Vata can cause low or diminished libido, disturbed sleep, insomnia, interrupted sleep, problems sleeping. Also, it weakens pelvic muscles and can cause incontinence and increased frequency of urination and UTIs as well. And UTIs would be mainly caused by the vaginal dryness and thinning of the vaginal walls as well. And all that falls under Vata. It's important also to note that proliferation of stress hormones in the first half of life significantly aggravates Vata energy, not just through the first half of life, but at the menopause and later on. So the next force is Pitta. And Pitta symptoms at menopause can show as emotionally as anger, irritability, jealousy, stress. In terms of menstruation, Pitta energy can cause abundant prolonged bleeding. I've had some patients who would say they're bleeding for 6, 7, 8, 9 days, and some even more. So that Ayurvedically falls under a Pitta symptom. Pitta, inflammation, heat, liver, think gallbladder, pancreas, think acidity and toxic blood. Blood is governed by Pitta as well. And the result of that could mean abundant prolonged bleeding during the periods. It could also impact cardiovascular health and elevate blood pressure and pulse frequency, hair loss, redness of skin, headaches, migraines. Now the menopause trademark, 80% of women will experience hot flushes. Technically, hot is affiliated with Pitta, but the flush itself, the movement, right, also has a Vata component to it. So from an Ayurvedic point of view, hot flush cannot be managed effectively just through managing Pitta. Vata still needs to be managed, right? So then Pitta is responsible for night sweats, increased sweating, and also affected memory and concentration. Kapha symptoms in menopause can include sadness, depression, lethargy, fluid retention, edema, eventually higher cholesterol. But again, that's secondary to the liver issues and liver not being able to metabolize hormones properly. Lack of motivation, slow digestion, slow circulation, weight gain, and losing that luster that the babies have as well, like duller skin. So that's symptoms of the menopause according to an Ayurvedic classification. Now, it's also important to note this. Menopausal symptoms are aggravated by a few other factors. And one of them is the disturbance of the tissue metabolism. And this is the tissue metabolism in Ayurvedic understanding, particularly in the final bodily tissue, which is the reproductive tissue called shukra. So if the tissue metabolism, you take food, then it's processed by the body and becomes plasma, then it feeds the blood tissue, and so on and so on. So if that metabolic cascade is not happening properly in the body, then it's not a good thing. It can exacerbate menopausal problems, or it can potentially cause an earlier menopause as well. The next issue that aggravates menopausal symptoms is high AMA in the body, AMA. And AMA Ayurvedically is both gut and tissue toxicity caused by improperly digested food. And you can see the pictures of the tongues here. So in simple way, AMA is that coating at the back of the tongue that starts coating firstly the entire digestive tract or bits and pieces of it, sits there, so to say, rots, accumulates, then causes inflammation in the gut, increases gut permeability, and through the gut, then it starts traveling around the body and lodges itself in weaker organs and causes problems. So high AMA is not a good thing. The tissue toxicity is not a good thing, and it can be in the gut or in any other tissue of the body. Low Agni or digestive fire or digestive capacity is not a great thing for anybody, let alone the menopausal time when the tide goes out and everything is bared out, and so we'll need to work on increasing our digestive capacity. Congested lymphatics, which in Ayurveda is called rasa, which is sort of a function of the high AMA, then that travels through lymph, travels through plasma, starts traveling through blood, and causes congestion and clogs both physical and subtle channels of the body. Congested liver, gallbladder, and pancreatic function is key to address, particularly with all hot flushes and symptoms of heat. And last, suppressing natural urges actually it should be, such as elimination, rest, emotions, an urge to rest, for example, or thirst or hunger, also aggravates menopausal symptoms, and in a big way aggravates vata, the energy of vata in the body. So a little bit on the premature menopause, which is sadly all too common nowadays. So the forces and the factors that can lead to the premature menopause from an Ayurvedic and from the Western perspective largely are these: excessive mental and emotional exhaustion during younger years. The body has, Ayurveda teaches us that the body is born with a certain amount of reserve. And when that reserve is used up, there's not much left. So let's work on not using up our reserves, whatever age we are, but on growing and building up on them all the time. Prolonged stress, overwork, and extending on urges, that reservoir of health reserves, especially combined with insufficient rest. Depletion, both physical depletion, but also emotional and mental depletion, very, very important. And lack of warmth and nourishment. And in that context, I would like to give you a quote of my mentor, Dr. Claudia Welsh, who I absolutely adore, who says, "Over the years, I have seen that the medical problems of most women who come to me are rooted in a hormonal imbalance brought on by doing too much while getting too little physical, emotional nourishment." So I'll leave you with that thought, but this is very, very important to find your own nourishment. It's nobody else's responsibility but yours. Whether it's one or two of your trusted friends, or a hobby, or a family, or a partner, or a husband, or even your mom, or a practitioner of sorts, right? Next marker of premature menopause is excessive ambition, achievement, self-sacrifice, that kind of go, go, go person who can't switch off, which a lot of Pitta women are prone to, and eventually leads to young burnout. Endocrine disorders, autoimmune conditions, certain genetic factors, viral infections can lead to premature menopause, as well as certain surgeries and even chemotherapies. Ayurveda also teaches us that constant, incessant self-talk, excessive activity, being active, traveling too much, interestingly, right? A lot of air travel is not good to the female system, and it throws up endocrine and hormonal systems. Inability to switch off, they all disturb the forces of Vata and eventually bring the Vata age closer. And then the Western medicine also teaches us that 60% of premature menopause is idiopathic, meaning we just don't know why it happens. But from an Ayurvedic point of view, we can apply the Vata Pitta Kapha paradigm and see what's going on. So that's an overview of the changes at the menopausal time. And now we're going to start part 2, which is what to do at menopause from an Ayurvedic perspective. Before we go there, I would like to make a couple of comments. So Ayurvedic routines, to some people, might seem like, oh my God, there is just so much to do and I'm already so overwhelmed going through all these hormonal changes. And if I don't do everything, I'm a bad little Ayurveda person, and that can add up to guilt, frustration, and aggravate Vata and ultimately exacerbate the symptoms. So I would caution you against that. This is actually not the right or conducive approach, right? Ayurveda teaches us that all changes in the life should be done gradually, should be introduced gradually into your life, to your body, to your mind, and to your system. It's very important not to put your mind or body into a shock situation, particularly at perimenopause and menopause. We want everything to be smooth. We want to manage the Vata force. We want to manage the Pitta force of the body. As menopause is predominantly Vata Pitta, can have some Kapha symptoms as well. So before we start going through what needs to be done, there is a lot of information that we're going to be talking about now, a lot of details. So I'd like you to I'd like to encourage you to take a note of that, but choose a few things that you might, that call you the most, that you might enjoy the most, and it's often the little things that make up the biggest difference. And make these small little things your own, include them, assimilate them in your life, feel their result in an enjoyable, stressless fashion, and then maybe take something else and include something else in your life, right? So don't think like that you need to do everything that we're going to be talking about straight away tomorrow. Just play, experiment, see the impact on your body and feel how your body responds. And the body responds. Our bodies have an immense natural ability to heal. And that's what Ayurveda is natural ability to heal and come into balance. Right? So what is an Ayurvedic approach to menopause? Number one, opening to inner wisdom, redoing the inner talk, reframing the mind. Diet, we're going to talk about daily regimes and pranayama practices. There are certain Ayurvedic body therapies that are very indicated during the time of menopause. as well as herbs and herbal medicines. And we're going to talk about Ayurvedic procedures called Panchakarma and Rasayana as well. So opening to inner wisdom. Opening to inner wisdom for a lot of us involves a lot of inner search. So it's probably not a good idea to do that inner search in the middle of a hot flush or an anxiety or a panic attack that you are having. But it's a good idea to do that inner search in general during that transition time, to come to reconciliation with the past, to accepting life as it is and welcoming the future as well. Whether that means for you to take, that you will take quiet contemplative time to yourself, or asking for help. Asking for help is actually a sign of strength. So asking for help, going to counseling, psychotherapy, somatic therapies, Ayurvedic bodywork, acupuncture, energetic health, yoga, relaxation retreats. There's a lot of options available, or just simply being on your own and exploring your inner world as well. Paradoxically, during the time of change, transition, and upheaval, a lot of women nowadays resist that change because resist the change of menopause because we've got youth and youthfulness on the pedestal, not as much the wisdom of the later years, right? And that resistance further aggravates Vata and Pitta. And once that resistance goes, once that resistance melts, and the situation is the new situation, the new life stage is met calmly, in a calm, slowed down fashion, and possibly even for some women even welcomed, right? Then it opens us to the new opportunity within, and it also helps to a lot of the time, right? And ultimately, how do we make the menopause the rite of passage? How do we see a new opportunity in it, right? Also, there are a lot of options in Ayurveda of where to start. And for some women, the menopausal transition can be very severe and very extreme. So even if you're feeling the lowest, you could just still start somewhere. Little things that can help, right? It's for most women, it's the simple things adopted day to day that make the biggest difference, not one big cathartic thing at all. In fact, talking about cathartic things, I have put here energetic health. I'd like to elaborate on that a little bit. Ayurveda teaches us that all, transient energetic activities where we go, so to say, out of our body, like clairvoyant experiences and shamanic practices, are actually very vata aggravating, right? And they need to be done by a person who is very stable and very grounded. Only then they are safe and beneficial to the person and other people. So the time of menopause, when the vata is aggravated in the person, is probably, in my opinion, not the best time to do cathartic, energetic health work, but more so gentle, energetic health work, oriented on the body, uncovering the body wisdom, supporting the body, mind, balancing, receiving the nourishment, receiving the that the body needs. And then once the transitional period is over and the body is firmly established in the new patterns, then you can do other practices, right? So now, it's extremely important that even if you don't listen to anything else, this slide is the it, right? It's extremely important for us to be able to learn, for the Western women in particular, women And most women don't actually know at all how to rest. With my patients, when I ask them, how do you rest? What they give me is this. They say, oh, I just watch movies. I spend time on the internet or shopping, right? But from an Ayurvedic point of view, that is not rest at all. It actually disrupts natural cellular intelligences. Internet, social media, movies, even studying, right? Even doing webinars, screen time, shopping, decision making, all aggravate Vata and Pitta energies. They, in other words, they take our resources, they don't fill them up, they fill us up. Being in cold, windy environments aggravates Vata. So if you are menopausal, it's not a good idea to be in cold and wind. And hot climates and environments aggravate Pitta. Alcohol is also not a great relaxant, right? What is a great relaxant? Dedicating time to yourself, prioritizing yourself, taking as much as you can, 30 minutes a day. You should be able to find for yourself. 2 hours if you can, do what you can. But take the time for yourself and do something that you actually enjoy. Deep breathing, diaphragmatic abdominal breathing is a must to learn. Again, most of my patients, when I ask them to take breaths, right? And if you put your hand on your abdomen and another hand on your upper chest, so most people will make a deep breath like that. But this is not deep breath. Deep abdominal breathing is when your belly protrudes first and slowly breathing in through your belly, and then let your chest rise. And then breathe out starting from your belly, and then slowly make your chest full. So let's make a couple more breaths like that. Deep breath through your belly. And breathing out. Breathing in. And breathing out. So breathing in that fashion a few times a day will significantly improve all hormonal health, menopausal or not, perimenopausal or not, all nervous health, activate the parasympathetic system. In the last couple of minutes with me, you already probably just from 2 breaths feel the difference. I do. So deep breathing every day, a few times a day, morning, lunch, and evening, will ease the menopause considerably. As well as spending time in nature, connecting with nature. Use your hands to connect with nature. Touch the trees, the boulders, the sand. Look at the stars, look at the ocean. But don't look for 30 seconds, look for 20 minutes. This is rest, right? Toning our nervous system down. Look at the flower for a long time. Lie on the grass, look at the sky. Listen to calm, relaxing music for 20-30 minutes. Meditation, but again, as I said before, I would recommend more bodily oriented meditation during menopausal time rather than transcendental, those types of meditations when you get out of your body. Meditation, yoga nidra, which is a wonderful relaxing bodily practice, gentle mindful yoga combined with you will find that just doing gentle, mindful, slow yoga, hatha yoga, is wonderful. You might find that certain memories will start popping up, and you might get emotional. You'll be releasing these memories, right, and working through your emotional body that way, which is wonderful. Also, very, very important is to stop and have a break before you get tired, and don't push through. So it's generally not good for female health to push through at all, but how often do we do that, right? Particularly it's important at the time of menopause, because menopause is the transition into Vata age. We push through, we deplete our reserves later on. We need to think about what's going to happen in the next 10, 20, 30, 40 years, right? For a lot of us. And resting is very, very important. Receiving regular massages, but not during menstruation. Bodily treatments in Ayurveda as it is a natural cleansing time when your physical and etheric bodies slightly change configuration. So it's actually not great for you during menstruation to do any hardcore practices. Like some spiritual traditions and religious traditions don't even welcome you to church or to temples during that time, right? So Ayurveda does not recommend massages. And also we spoke about a form of Vata called the Panavata during menstruation. That's the downward force. It's very important for it to go flow properly. So, and massage will for example, head massage will turn the energy up. So it's not a great thing. Spending time with warm, loving people. Having 1, 2, 3 friends, warm friends, loving, non-judging friends with whom you're comfortable with, just to be yourself, right? Joyful hobbies. Again, important not to push through these hobbies. Painting, handcraft, cooking, gardening, whatever calls you fancy, as long as you push through them, but enjoy them and let your creative force manifest through them. Right. Now let's have a look at the recommended diet. So these dietary principles are true at menopause, but also very also recommended in Ayurveda for any female and female health in general. Right? So the key on the diet is to have, number one is regularity, because the Vata force is sporadic, it's all over the place. And regularity combats Vata. Regularity calms the nervous system down. Regularity improves the quality of neurotransmission, serotonin, dopamine. Regularity improves our peristalsis and elimination. So warm cooked meals with appropriate oilation, not too much oil, but not too little, at regular times. Avoiding Vata aggravating foods. And this is interesting because in our day and age, raw salads, for example, is a very, very popular and a way to go for a lot of people. But from an Ayurvedic point of view, raw and cold food actually aggravates the force of Vata. So drinking sparkling water, cold sparkling water, or any cold drinks during foods during meals will dampen digestion, will dampen Agni or digestive fire, which will lead to formation of armor, block lymphatics, etc., etc. Raw salads also can't be digested properly. That's what Ayurveda holds, particularly by people with high Vata, because raw vegetables in particular, because it takes much more of enzymatic function to break intact cellular walls rather than already pre-cooked meals. So the bioavailability of that food Ayurvedically is not that high. Pitta aggravating foods, which is to avoid during menopause, are hot, stimulating, and sharp foods like coffee, chili, alcohol, all fermented foods. Although in the functional medicine world, the fermented foods are a wonderful thing and create a and form pro and prebiotics and improve microbiome, and they do, right? And in certain conditions, they are highly recommended, of course, particularly when you for pitta, when you have hot flushes or high aggravated pitta, they will increase heat in the body and they will overheat the body. That's why Ayurveda does not recommend to have them for high pitta, right? Too much salt, yeast, peanuts, tomatoes, yellow cheeses, and sour tastes like sour apples will aggravate pitta as well. And to some degree, oranges and other sour fruit. Kapha aggravating foods that will cause channel blockage and mucus formation, cold heavy foods, cold yogurts, any cold milk products, white flour, sugar, and all these cakes, you know. Now, what to have, how to eat. Particularly at the time, what does Ayurveda teach us? Firstly, fasting. Ayurveda does not recommend fasting for any Vata dominant conditions. And let's just say we agreed that menopause is Vata/Pitta dominant. Vata is still the dominant force because it's transition on transition and moving into the Vata age as well. So, fasting is recommended for Vata dominance. Fasting can be done a little bit for Pitta and a little bit more for Kapha, but not during the time of menopause. So regular meals at regular times, not being hungry, but at the same time, not eating after 6 p.m., not having large dinners is critical, because in the evening, our metabolic fire, our digestive fire is not as strong as during the day. So an ideal meal in the evening would be food. And having nourishing lunches and substantial breakfasts as well. And if you're not hungry for breakfast, then in the majority of cases, it means that you've clogged your bodily channels enough with late dinners that you're not hungry. So start curbing these late dinners down. Now, what other regimes are used, or dietary regimes are useful during menopause? Reduce your protein consumption, particularly of meat proteins. This is not only Ayurveda, modern medicine recommends that as well, because it will affect a variety of hormonal cascades and liver metabolic activities as well. So reduce your meat intake, and if you choose to eat meat, eat it during the day, not in the evening. Increase your lentil intake if you can digest lentils, but make sure you pre-soak them. Use hing or cooked onion and garlic, and make sure the lentils are really well cooked. Raisins with pre-soaked and peeled almonds are very beneficial for female hormones. Raisins are, so to say, one of the phytoestrogenic foods, and so are lentils. Prunes. Prunes are highly recommended, but soak them, pre-soak them before. It's not all dry foods aggravate Vata. That means the body will need to work harder to break them down. Pre-soaked prunes, they're wonderful to have. They will take the extra heat out of the body. Dried fruits, sesame seeds will also promote estrogen in the body. Cooked garlic. Garlic is an interesting. In Vedic, garlic is put into the rasayana, or rejuvenative substances, right? So cooked garlic is recommended during menopause, but don't have too much of it for hot flushes. Fresh seasonal fruit, particularly berries, cruciferous vegetables, but just make sure with thyroid conditions you go easy on cabbage and broccoli, and cook them well. Include herbs and spices with cooking, such as turmeric, coriander, fennel, fenugreek, ginger, cardamom, cumin. You can pretty much, in moderate quantities, include any spices that you like, except for chili. Ginger can also increase heat in the body, but at the same time, it has a benefit of unclogging the channels. So you can have ginger, and it's very beneficial if you have moderation. So now kitchen remedies. So kitchen remedies. Aloe, you can take aloe juice, you can take fresh aloe, or you can take aloe powder and mix 1 teaspoon with a quarter of a teaspoon of dried ginger powder and warm water, and take that every morning for 10 days. And this is a wonderful remedy for removing heat from the blood. It's a great tonic both for the digestive and female systems. It's cooling. It's great as liver support. So this is a wonderful remedy. Also, for menopause, but also if you have digestive conditions, it's good to do a short-term 10-day course of that. Fennel seeds. Fennel seeds are your friend. So you can just make, and that's fennel seeds that are in the picture. Fennel seeds, you can take a half or 1 teaspoon to taste, add boiling water and brew it as tea. And it's a wonderful tea to drink throughout the day. It has a cooling after effect on the body. It relaxes the body, provides urinary support, and tones urinary system. And it's also a nervine and brain tonic. And you can't actually overdose on fennel seeds. They're great digestive, so a very great support. You can even use thermal mugs or flasks. It's a great support during menopausal time, and not just and before and after. Fenugreek seeds or powder. In the same way, to taste, half or 1 teaspoon with boiling water, make a tea out of that. Fenugreek is actually natural phytoestrogen. It nourishes female system. It also helps to lower cholesterol. It helps to unclog the clogged channels, helps to process hormone toxicity in the body. So also a very wonderful kitchen spice, widely available nowadays. I've seen it in Woolies, for example, and all Indian shops stock that. So it's a beautiful spice to have. You can add it to meals, or you can drink it as tea. Licorice. Licorice removes very effectively heat from the liver and blood. It's great for UTIs, and some women frequent UTIs once their hormones start to change for a few years to menopause. So licorice is your friend. However, it should not be taken for prolonged periods of time in large quantities. So 1 or 2 times a day for 2-3 weeks, you can take licorice tea. In Sanskrit, licorice is called yasti madhu. Madhu is sweet, so it's got a natural sweet taste. Wonderful support. Saffron. Saffron threads are a beautiful, beautiful way to nourish reproductive and endocrine tissues. Very highly recommended for all females, particularly if there are any thyroid tissues, thyroid disorders. It's a great way to strengthen thyroid, strengthen the heart, and a lot of other beautiful benefits. In high doses, though, saffron is not recommended. So use it very sparingly. Use a little. If you buy 1 gram, saffron's quite expensive. So if you buy 1 gram of it, it's sold by grams usually. If you buy 1 gram, that don't make a decoction of the whole gram. So make sure you put only 1, 2, 3, 4 threads only. And make an infusion in warm water or milk. You can drink it, you can add it to drinks, you can even add it to rice, but make sure you never boil saffron. You just add warm water to it, let it kind of steep, and use that. Rose, another beautiful remedy. You can buy rose petals. I've seen them at a lot of Chinese stalls, health food tea shops, and even rose powder, petal powder. So rose is a wonderful remedy to clear heat, particularly from uterus and blood. Rose has an affinity for the female reproductive system. It's got a quality of enhancing libido, useful for emotions, heart palpitations, useful for the heart. You can't overdose in it, so it's a wonderful support. So stock up on these spices. Even if you're not in menopause, they're still wonderful spices to have in the kitchen. Right. Next regime is self-abhyanga. Abhyanga is oleation. So when we talk about self-abhyanga, we talk about self-massage or self-oleation of the body with warm oils. And it is an essential component of all Ayurvedic regimes and all Ayurvedic therapies. So why warm oils? So firstly, the quality of vata, as we talked. The quality of vata is erratic, dry, cold, right? And the vata phase, or the older phase of life, is characterized by the accumulation of vata energy. When eventually we lose the juiciness, we develop wrinkles, our bodies shrivel and become harder, right? So self-abhyanga and body oleation is highly effective in combating that problem. It's a great way to detoxify the body and to rejuvenate it. So much so that, so if you can imagine a cell, right? With age, so when we're young, our bodily cells are nice, juicy, and plumpy, and they are taking in nutrients and releasing the metabolic byproducts easily, and everything's flowing. As we age, stress, bad food, alcohol, coffee, whatever, as we age, our cells kind of shrink a bit. The colloidal stuff inside the cell becomes gooey. The mitochondria can be damaged, and the cells become less perky. They become dull, and oil massage is one of the best tools to actually start opening them up, start supporting the mitochondria, start getting the toxicity out of the cells and rejuvenating the bodily cells. So in that way, it's one of the best detoxification methods that you can come across and rejuvenate the body. It slows down cell degeneration that ultimately causes our demise, reduces physical tension and fatigue, nourishes the nervous system. Oils, right? Our nervous system, the myelin sheaths, are made of fats. So the brain tissue, it will nourish the nervous and the brain tissue directly. Self-massage promotes psychological and physical stamina. Is the ultimate to pacify the nervous system, endocrine health, joint, bone health, skin. It has a cumulative effect. So if ideally, Ayurveda recommends to do it every day in the morning, 7 days a week for your whole life. For a lot of us, if it causes extra stress and if it's not practical and you can't do that, then do what you can. You can do it 3 days a week, or you can even do it in the evening. Just make sure you do it on an empty stomach, right? It's still a wonderful way to support yourself, right? So there are a lot of oils, Ayurvedic oils, herbal oils that are specific to very different health conditions that Ayurveda uses. Before we talk about the oils, the specialized oils, good generic oils for self-abhyanga or self-massage, black sesame oil, cold pressed black sesame oil, not the toasted sesame oil. That's good pretty much for all doshas. Or you can use coconut oil, particularly in summer, particularly for pitta symptoms, particularly for hot flushes. Coconut oil is considered to be cooling, to have cooling properties in Ayurveda, right? Ayurveda does not recommend the use of olive oils. And in my personal experience, the olive oil molecules are a little bit too thick, too fat to penetrate effectively through the skin, while black sesame oil is actually quite thin and it penetrates all the 7 layers of the skin quite easily, and it's most beneficial. Now, just remember when you do the self-massage that the oil should always be warm. Never cold oil both inside and outside of the body. And ideally, self-massage should be done for females, starting on the left side, massaging the legs to the direction of your heart, your arms and hands to the direction of the heart, belly in a clockwise fashion. It's very important to massage the breasts to remove any possible stagnation, right? And the arms, there are specific oils for head massage and specific oils for face as well in Ayurveda, which are wonderful to use. And I will email you all with the recording of this webinar. I will email you the instructions for self-massage. So generally, massage is done in the direction of the heart. A couple of little notes here as well. If you have broken on legs, or if you have varicose veins, you need to go very, very gently over, right? But if you have broken capillaries on your veins, then the best style of massage is if you massage first towards the heart, but then on your legs, finish with the gentle downward strokes, right? That's a little tip. And now let's talk about specific oils for self-massage that are recommended during the time of menopause. Thing I forgot to mention about the massages is the Ayurvedic self-massage. We spoke about the energy of Vata ultimately having an affinity for the bone and joint, for the bone tissue, right? So our bones are actually not static. They're not a piece of plastic. They're an alive thing. They're constantly, they constantly break down and are being rebuilt, right? And when the breakdown happens quicker than the rebuilding in the Vata phase, we want to avoid that. That can lead to osteoporosis and other problems. So self-massage is a wonderful way to support the bone health in the Vata age as well, right? So now oils specific for Vata, oils for self-massage, Ayurvedic oil specific for Vata, the so-called Vata oil, or Mahanarayana oil, which is great for Bala and Vantram oils. These oils have slightly different properties, but essentially all of them will support joint and bone health, muscle health, nervous system, and the reproductive system. Bala Ashwagandha Bala, so Mahanarayana, is also great for the reproductive support. Bala Ashwagandha oil. Bala means strength, so it's a great tonic for fatigue and tiredness. Then Vantram oil is a great oil for the whole body, nervine tonic, and one of the most renowned oils in Ayurveda, actually. So now moving on to Pitta oils. Which oils are best used for Pitta? Kshira Bala oil. Kshira Bala oil. Kshira is milk and Bala means strength. So there's, you can't actually see milk, but it's cooked. This oil is cooked with milk. In general, a lot of Ayurvedic oils are boiled with oils, herbs, 20 to 40 different herbs, usually in one oil. Formulas as per the Ayurvedic scriptures. The most well-known scriptures are Charaka, Samhita, Ashtanga Hridaya. So a lot of these oils are boiled for days to make sure that the active components of the herbs give themselves to the oil. And sometimes the oils are boiled with other substances like In Kshiravada case, it's milk, right? And milk is a cooling substance. So this Kshiravada oil is wonderful for hot flashes, insomnia, osteoporosis, bone support. It's slightly cooling, right? All oils for Pitta are slightly cooling to the body. Chandanadi oil. Chandan is sandalwood, but this oil does not only have sandalwood, it's got a lot of many other synergetic herbs as well. So Chandanadi oil is cooling, relieves burning, supports liver. Lavender oil is great for headaches, stress, gray hair, eye health if applied on the head, right? Ayurvedic oils for kapha, kapha oil, Punarnavadi oil, which is slightly heating because kapha is cold. We need to heat and stimulate it a little bit, but it's great for edema, swelling, kidney problems, weight gain, diabetes, for example, right? Right. So now the next Ayurvedic, unique Ayurvedic treatment that you can do at home and professionally is nasya or nasal drops, right? And you might be asking, why nasal drops? On the first slide, when we spoke about the hormones, about estrogen and the FSH, the follicular stimulating hormone and the luteinizing hormone, the last two are actually our hypothalamus and pituitary gland give command and control these hormones, right? So by applying special medicated oils into the nose, you are exerting a positive balancing effect on hypothalamus, pituitary, and pineal glands, right? Also, it's great promotes hormonal and endocrine health because it's all controlled from the little glands we have in the middle of our head. As well as has a very positive effect on sinus mucus, drains mucus in the sinuses, in the head, drains congested lymph from the brain, relieves headaches, migraines. So this is an Ayurvedic regime that's highly recommended for all hormonal problems. You can do it at home, or you can get it done professionally. There is a slight difference between the two. And what you do at home is you warm up the oil, which usually comes in a glass bottle. So you put the glass bottle into hot water, warm up the oil to a warm temperature, not boiling hot, but warm, and apply 2 drops into your nostril every morning. And then you might need to spit out or do whatever, but don't swallow the stuff that comes out. The oils, the best oils for nasal drops, you can use black sesame oil, you can use ghee. The best oil is anothylam oil, which is a herbal medicated oil. You can use Kshiravada oil that we spoke about previously here. Kshiravada and oil. You can use Kshiravada and Chandanadi oil as well for the nose drops, but you need to make sure they're not of supermarket quality, but they're of high quality if you're using oils and mucous membranes. You can also use Brahmi Ghritam, which is Brahmi ghee in a different formulation in Ayurveda, and a number of other ones, right? And they will all have different effects. If in any doubt, you can safely use black sesame oil or ghee. For Pitta symptoms, ghee is best, or anothylam oil is a wonderful detox for everybody, right? Now, other home therapies that you can do at home, which virtually have no contraindications. One of them is called Yoni Pichu. Yoni in Sanskrit is vagina. So Yoni Pichu is an application of oils, special oils to counteract vaginal dryness. And women suffering from UTIs might find a huge relief here as well. Or if some women start having painful intercourse when the hormonal changes onset, so there will be a huge relief here. If you have to use lubricants during intercourse, then it's best to use that rather than the synthetic lubricants. What So you can use plain ghee. Ghee is clarified butter, not just melted butter, but clarified in a certain way. Or you can use medicated ghees like Shatavari Ghritam or Palakalyam Ghritam. You can use medicated ghees for that procedure as well. The contraindication to using medicated ghees is fibroids and all sorts of uterine growths. So it would not be wise because to use the medicated gritams with that. And how you do it is you can apply it internally on a tampon or with your finger, or you can even use a little douche. Put it inside for 3-4 hours for 7 days, and then you can do once a week thereafter. And it's a great support for women after the menopause. I also know that some Ayurvedic experts, like for example, Dr. Vasant Lad, recommends to use black sesame oil here as well. But in the majority of sources, I've been taught that ghee is best, right? So you can use probably both, not at the same time. The next home remedy that's great for stress, insomnia, mental, nervous tension, anxiety is Shiro Pichu. If Yoni Pichu is application, vaginal application, Shiro is head, so it's an application to the head. So what you do is you take a cotton pad and moisten it with Brahmi oil or Kshirabala oil, or you can use Chandanadi oil, or even plain black sesame oil, and apply it on the forehead, in the middle of your forehead. You can also apply it to the top of your head, to your crown as well, but logistically it's a little bit more difficult. It might fall off if you have hair, which I hope you do. So you apply a cotton pad on your forehead, and then you lie down and rest for 20 to 30 minutes. You do a yoga nidra. You can just relax, you can feel your body, and it will be very, very beneficial. Another home remedy that's easy to do is head oleation. Again, applying warm Ayurvedic oils on the head will immensely assist, relieve stress, any mental disturbances, premature graying of hair, hair loss, and nourish the brain and the nervous system. The best oil to use here is Brahmi oil, no question. You can always warm, but not hot. You don't want to burn yourself, right? So you never heat the oils in plastic bottles. You always, if you get the oil and it's in a plastic bottle, as most Ayurvedic oils are transported in, that you immediately change them into a glass bottle, and then you can warm it in boiling, put the glass water bottle in the boiling water and warm it up that way, right? And then apply warm oil in the head, massage in, and keep for a few hours and wash off. 1, 2, 3, 4 hours, as much as you can bear. I used not to be able to sleep with it, but now I found a way, a little cap that I can sleep with, and if you're comfortable with that, you can sleep with it on as well, and you can wash it off in the morning a few times a week. Great support, always during the time of stress and at menopausal time as well. Yeah. Next, professional Ayurvedic therapies that are highly recommended during menopause is Ayurvedic massage, specifically with light steam treatment. And it's interesting that you might say that I'm hot as well. Why do I need steam treatment? Heating me up. It's actually light steam will pacify vata and open up the blocked channels so that the pitta, the forces of pitta, the blood, starts circulating better. And It's very pacifying for all three doshas, Vata, Pitta, and Kapha. Supports lymphatic detoxification, skin, nerve system, relaxation, longevity, you name it, right? The next Ayurvedic therapy highly recommended during, it's a professional therapy, you cannot do it at home, Shirodhara. Shirodhara, that's what you see on the picture to this slide here, when a continuous flow of warm or warmish medicated oil is poured onto the forehead in a stream, and the duration could be between of treatment, depending on the dosha and the condition, predominant conditions, could be between 30-40 minutes to an hour and 15 minutes, right? So this is a wonderful treatment to support pineal, pituitary glands, the neurotransmitters, serotonin, dopamine, and there is a lot of scientific research on how the Shirodhara treatment impacts the quality of serotonin and dopamine transmission in the body, which of course we know they're the happy and the relaxation hormones. Brain and nervous system support, deep relaxation, hormonal and endocrine health. Another treatment that's very recommended for, specifically for, particularly for kapha type of conditions, is Udvartam massage, which is a very vigorous, stimulating body massage with herbal powders. It's great for things like improving circulation, edema, onsetting diabetes, water retention, weight loss. It's #1 Ayurvedic treatment for diabetes, for example. A couple of other Ayurvedic treatments that are recommended, but not as widely available and not on this slide, are these. Navarkizi bolus, which is a treatment done with special boluses with special herbs and nava rice, right, which is cool and milk. It's cooling, nourishing for the body and the nervous system, and takes extra pitta or heat out of the body. And a treatment called Pijichil, which involves pouring. Like in the Shirodhara, we pour oils just on the forehead, right, supporting the brain. But in Pijichil, we pour warm, specialized warm Ayurvedic herbal medicinal oils with very light massage over the whole body for about an hour. And that wonderfully supports and nourishes the body, particularly great for Vata pacification. So these Ayurvedic therapies are highly recommended at menopause time. And now sleep. Maybe let's check in with you guys if you're still there. If you can put a note saying, yes, you can hear me, would be great. No, nobody's typing anything. Yes, yes, okay. Yes, sorry about the internet connection. I don't know what else to do about it. Yeah, okay, great. So let's continue. Sleep. Ayurvedically, there are 3 pillars of health. The first one is correct nutrition. The second one is correct rest and sleep. And the third one is warm, loving relationships, and that includes sex life too, right? So sleep and rest is actually a health pillar in Ayurveda. So no amount of popping up hormones or this and that and what else, taking medications is going to make up for lack of sleep, right? However, in menopause, when Vata is upheaved and disturbed, it becomes very, very difficult for some women to fall asleep or to stay asleep, right? And some women wake up with some incessant thoughts Hot flushes sometimes become worse during the night. The symptoms actually vary woman to woman, person to person, and they can be very different, right? Some women might go through menopause with minimal symptoms, and we know from what we spoke about before, that means that her doshic balance is probably much stronger, right? And less toxicity in the body. And other women might go through a time of great upheaval, could be totally horrid and bad. And it's important not to judge the self and not to judge the others, but just to accept. It's also another important thing is that the age of menopause nowadays varies quite a lot. So if you're a woman in your late 50s and still menstruating, right, it's wonderful. But just be mindful that there could be women around you that are much, much younger that are struggling with what's going on for them hormonally and psychologically, and they a lot of women don't even know who to turn to, who to talk to about that. They just talk to their GP, but it can be a very challenging time for a lot of women. So now we're on the topic of sleep. So what do we do? What a good sleep is, and then what do we do when we can't fall asleep, right? So it's critical from Ayurveda, being an elemental science, doesn't look at things only through the material prism. Meaning that when we look at diet, we talk about warm, nourishing meals. We don't talk about the carbohydrates, protein, and fat, or calories, right? So when we look at sleep, we don't look just at quantity of sleep, but we look at time of sleep. And time of sleep is critically important, right? From 10 p.m. to about 1 p.m. is a time in Ayurveda when the physical body gets rejuvenated, when the liver, pancreas, all these pitta organs get repaired by the body and restored, and the body can focus on their function. So what that means is that if we are not in bed and trying to fall asleep at 10 p.m., if you regularly are going to bed at 11, 12, 11, regularly for years, years and years, right? You can pop any pill you like, but you will need to have a look at your bedtime because it's counterproductive, right? So bringing up the bedtime earlier, before 10 p.m., ideally between 9 and 10 p.m., is critical through life. You're building your reserves, you're resting well, your body gets rejuvenated and replenished. If you don't do that, and there are people of stronger constitutions who use their body and go to bed late, that will still have a weakening effect, right, on them eventually over time. Weakening effect both or either or physical and psychological bodies as well. So particularly at the time of hot flashes, even if you haven't started in your youth, the time is now, right? Particularly for hot flashes. You will notice that if you go to bed after 10 p.m., your hot flashes get worse. They're aggravated. After 10 p.m., the pitta cycle kicks in. You might not be able to fall asleep as easily. Problem. So sleep rule number 1, be in bed before 10 p.m. For you to be next is gradual approach. If for years you've been going to bed at 12, if today you go to bed at 10 p.m., you wouldn't be able to fall asleep. So do it gradually. For the first week or two, go to bed 15 minutes earlier, then another 15 minutes, another 15 minutes. We don't want to jolt the body by any weird actions, right? We want always the gradual balancing. And similarly, getting up ideally before sunrise will wake up the body properly. In fact, some Ayurvedic sources state that if a female is asleep after the sunrise, then it will overheat the hormonal system, right? And make sure A lot of modern sources cite 6 to 7 or 6 to 8 hours sleep per day, but females actually need more sleep than males. 7 is probably, to be honest with you, not enough. 7.5 to 8.5 hours per day is ideal, right? And lack of sleep has major consequences. It increases cortisol, quickly, very quickly impacts hormonal and endocrine systems. And then the liver starts metabolizing cortisol. It has less capacity to look at proper hormonal metabolization of sex hormones, right? In fact, a lot of estrogen-dependent diseases are born of lack of sleep pattern, if that makes sense, right? Oops. So now you can say it's all very good to talk about sleep, but when you can't fall asleep, when the hot flushes, anxiety, whatever else is prevalent, what do you do? You know, how do you conduce your body into relaxation and into falling asleep? So firstly, and that we know, but most of us find trouble doing it, 2 hours before bedtime. So say from 8 p.m., if you're going to bed at 10, no blue screens. Blue screens, as we know, there is a lot of information out there. Just Google it. Melatonin production, right? There's no need to pop out melatonin pills if you are using blue screens just before you're going to bed at 12 p.m., not 12 at midnight, right? Not good. So no blue screens, meaning no use of telephone, iPads, computers, couple of hours before bedtime. If you can't manage a couple of hours, do 1 hour, right? We want the melatonin production to kick in, which can be only done in complete darkness and is completely blocked by the blue screen because the eyes and the brain interprets it as daylight, right? Evening regimes that help us to fall asleep. Mild evening stretching yoga. And there are a lot of beautiful yoga classes on YouTube now. Even just type in evening yoga or relaxation yoga on YouTube, you'll find your favorite channel. Meditation, relaxation, going for a gentle evening walk, doing yoga nidra, activating your parasympathetic nervous system, relaxing, closing off the day with different practices. If you have your own beautiful practices, great. If you don't, such practices reflecting on your day retrospectively, or looking at yourself in the mirror for about 5 minutes before you go to bed is a wonderful practice, right? Breathing and pranayama, especially the alternate nostril breathing, is great. Deep abdominal breathing that we've done before and alternate nostril breathing is a great way to relax the nervous system. Ayurveda recommends applying warm Ayurvedic oils on feet before you go to bed and then putting socks on. So that promotes a relaxation effect. Relaxing teas in the evening, chamomile, valerian, nutmeg. Nutmeg in small quantities only. It's a wonderful kitchen spice to promote good sleep. But at the same time, it can increase heat as well. So if you take it in small quantities only, or for short periods of time, or in winter better than in summer. Ayurvedic therapeutic herbs that promote sleep and support the nervous system. Pandhana, Shankapushpi, Botukola, or Mandukaparni. There are a few others as well, but as with everything, unless you know exactly what you're doing, it's always best not to self-diagnose with therapeutic herbs. But these herbs that are listed here are generally quite safe, generally. Now, if you could not fall asleep at night or missed out, woke up at 2 p.m. and couldn't sleep for 2 hours, Ayurveda recommends resting during the day. Ayurveda does not recommend resting and sleeping during the day normally, But if you didn't get a good night's sleep, then yes, do that. And what Ayurveda says is rest for half the time of missed sleep. For example, if you woke up at 2 o'clock in the morning and couldn't fall asleep until 4 o'clock, so you missed 2 hours of sleep, then rest 1 hour, half of the time during the day, right? It's very important to find time to rest. Even if you can rest for 10 minutes, that would be wonderful. Yeah. Exercise. So regularity of exercise is the key. Light or moderate exercise is the key. Exercising to maximum 50% of your capacity only. Remember, we're moving into the Vata age, Vata phase. Vigorous exercise is aggravating to the Vata energies. Exercise while breathing through the nose only, not through the mouth. If you find you need to breathe through the mouth, you're going too hard. Stop, rest, and then continue. Light sweat is beneficial. Walking, slow, gentle jogging, dancing, moving your body is important, right? But find the middle part. Gentle yoga is great. Not hot yoga, not Bikram yoga in this instance, because we already have a lot of heat in the body, right? Not power yoga or vinyasa yoga, but gentle yoga, small classes, holding postures for longer is equally effective, right? But the benefits of it are greater at this age than of power yoga, for example. Turn attention within while you're holding the posture and breathe through it. I haven't personally done Tai Chi or Qigong, but they are of course recommended and excellent practices to do, right? Now, another interesting thing is Ayurveda does not recommend any upper abdominal work for women, particularly at menopause and other crunches, because that can promote weakness of the uterus and possibly indirectly prolapses as well. And it's not great for conception even. So upper abdominal work is generally not recommended for females, interestingly, in Ayurveda, as are not recommended heavy weights or exhaustion, exercising to exhaustion. Light weights, body weight, great. Helpful yoga postures when you exercise. Butterfly helpful postures are generally either relaxing ones or the ones that draw attention to your pelvis and increase circulation and free up the energies in the pelvic area. So in the picture here, you see the Baddha Konasana, or the butterfly pose, when you hug your feet with your hands and then move your legs like a butterfly. It's a great way to activate the blood flow in the lower pelvis. So cat-cow pose, stretches, head to knee stretch, bow pose, child pose, Shavasana, or the relaxation corpse pose is great as well. So light, moderate movement is very important. Next. So pranayama is the key to your body and the brain. Pranayama is the key to the nervous system and to your bodily wisdoms, right? Pranayama done properly can be wonderful and bring wonders. Pranayama done improperly can bring problems, right? So pranayama that's recommended for Vata, for pacifying the Vata dosha, the nervous system, the brain, the mind, emotions, subtle channels of the body, is alternate nostril breathing, otherwise called Anuloma Viloma or Nadishodhana. And the way you do it, if you could do it with me now, I can't see you, but I hope you guys are all there, or ladies. So the way you do Anuloma Viloma or alternate nostril breathing is, I like doing it that way. So you kind of, your 2 fingers, you press against your palm, and then close your nose with your thumb and with your ring finger, and breathe in through the left side, gentle pause, breathing out through the right side, gentle pause, breathing in through the left side, breathing out through the breathing in through the right side, breathing out through the left side. And that's one cycle. So let's do 1 or 2 more cycles together. It's great to do this exercise. So if you've done it now with me, you've already noticed how it's like the vibration went down into your body, right? Even 1 or 2 cycles, you will feel calmer, more grounded, more in your body, more focus, more clarity, more peaceful, right? So again, we like gradual approach. So we start with 2 minutes morning and 2 minutes in the evening. And over a few weeks, gradually, we add up and we build up to 10 minutes in the morning, 10 minutes in the evening. This particular pranayama is great, not just us, but how you can do it. Everybody can do it safely. It's wonderful, right? And of course, when you do it, remember the abdominal breathing, right? Breathe deeply. If you are already very familiar with alternate nostril breathing and would like to take it a step further, then you can start moving energy through your what's called annamaya kosha and pranamaya kosha in Ayurveda. You can start moving energy up, and then you move energy down through your breath and your attention to what's happening. Moving energy up, moving energy down. But this is the next level, right? After you're comfortable just with breathing. The next pranayama, which is wonderful for pitta people, for pitta women and pitta conditions, is the self-harm or anti-bowl meditation. It's very cooling, relaxing the mind, inattention, stress. It's great for sleep, for inner peacefulness. It aligns the biological clock of the body to the circadian rhythms of life, right? And it's very, very simple. And I love it. I love it because you can do it even when you have other people with you. And even if you are walking on the beach and decide to kind of stop there and do it. And the way you do it is if you focus on breathing in, and notice when you're breathing in, your breathing apparatus kind of makes the soul sound. And when you're breathing out through your nose, not through your mouth, the sound becomes more like hum, right? Breathing in so, breathing out hum. So do it a couple of times now in your own time. And breathing out. Yeah. So this is a wonderful, wonderful way to calm, relax the mind. Do it daily, you'll see the difference. I just have a question about medicinal herbs. We'll come to that session in a second, Kalibola. We'll talk about Shatavari and the Shoka in a second. Yeah. Yeah, and we'll talk about Brinwich as well. Wonderful. So now, pranayama for kapha, basteka or breath of fire, sometimes called bellows breath, right? I do not recommend to do it at all for most women during late perimenopause or menopause, particularly because it ignites the fire and it can increase the hot flashes. But at the same time, if the woman doesn't have a lot of hot flashes, but she does have weight gain, slow circulation, lethargy, then yeah, it's a wonderful practice. So be mindful doing it. And it's done very simply, just focusing on forceful exhaling and let the inhale happen naturally. And it looks something like this. I don't know if you can, well, you can't see my belly, but so it's very quick, forceful exhales and natural quick inhales, right? So as I said, I don't recommend it for pitta conditions or people with high blood pressure. Right? So these pranayama practices are truly wonderful. The alternate nostril breathing, Soham, and the breath of fire if you need it, if the heat symptoms are not that predominant in your body. But if lethargy, lack of circulation is predominant, then yes, that's, yeah. So now we come to Ayurvedic herbs and herbal remedies recommended during menopause. So here there was a question about Shatavari, Ashoka, Bringraj, and here is when we're going to talk about that. So as with everything, unless you know exactly, herbs and herbal medicines are very, very powerful. And I've attempted to list here only individual herbs and the tonic preparations that are both widely available. And also, particularly the rejuvenative tonics don't need the prescription. They're beneficial for everybody. Be mindful when you're using herbal preparations. You need to know either exactly what you're doing because they're so powerful, or you get a professional advice. So my advice is to get the professional advice on Ayurvedic herbs and herbal medicines, right? So herbs for Vata dominance during menopause that are very, very beneficial. So now we'll talk about Shatavari, right? So Shatavari is an interesting, very nourishing female reproductive tonic herb. It's actually a root of plant, right? So it's very heavy, very nourishing. It's a natural phytoestrogen, although it does have some progesterone activity as well, but it's mainly phytoestrogen, right? Now talking about Shatavari, it's probably Ayurvedic #1 choice for a lot of Ayurvedic practitioners and Ayurveda enthusiasts. #1 choice tonic for the female reproductive system. And yes, it is, but be mindful because it's not always so. So with Shatavari, it's actually contraindicated in conditions like fibroids or uterine growths, or even fibrocystic breasts, right? So fibrocystic breasts, right? So Shatavari would not be the herb of choice in those cases, but or in some instances, excessive Shatavari is not recommended with thyroid disorders as well. Excessive Shatavari, right? But overall, it's a wonderful, supportive, great female reproductive tonic. It's wonderful for hot flushes. The way to take it for hot flushes, if you just get Shatavari powder, you can use half a teaspoon to a teaspoon. Again, be mindful of the contraindications, but generally half a teaspoon to a teaspoon of Shatavari with warm boiled milk in the evening. It's wonderful. It takes the peak of hot flashes very, very quickly, right? The next Ayurvedic herb that's wonderful for menopause is Vidari. Vidari, as opposed to Shatavari. Vidari is also a very nourishing reproductive tonic, but Vidari has more of a progesterone activity, right? So Shatavari and Vidari go very well together in combination. Or Vidari in a lot of cases is very indicated for people with thyroid or estrogenic dependency. Besant Lad, for example, recommends half a teaspoon of Shatavari, half a teaspoon of Vidari, or 50-50 combination for specific for menopause support, right? Another herb, Jatamamsi, is wonderful for sleep and promotes relaxation, promotes healthy functioning of the nervous system. Ashwagandha is a very famous adaptogen, promotes sleep, nourishing both for female and male reproductive systems. It's great as an adrenal tonic, great for, what do we call it, adrenal fatigue, thyroid disorders, chronic fatigue, all those kind of things. Ashwagandha is your friend. Brahmi is a wonderful, Brahmi Gotukola, Shangpushpi, a wonderful brain tonics and nervous system support herbs. And Shangpushpi is also great for the female reproductive system as well, right? Now we move to the Pitta dominant symptoms, and the herbs here are Manjishta. Manjishta has an affinity for blood, taking extra heat out of the blood. Great for hot flushes, great for all sorts of skin conditions. Sandalwood or Chandan, right? Sandalwood is very cooling. Now we come to the Bringraj. So we spoke about liver being very, very active for females, right? Systems here. So females can't drink as much as men. Females do need more sleep. Females can't eat as much, and females' livers are more fragile, for lack of a better word, more sensitive, right? So Bringraj, herbs like Bringraj or Bhumi Amalaki, or another wonderful herb is Kalmeg, for example. They take the heat out of the system and they balance the liver in a very, very powerful way, right? So just answering somebody's Kali Bollock's question here, do you treat hot flushes with Bringraj to cool the body? So Bringraj, Bhumi Amalaki, Kalmeg have an affinity for the liver. So yes, it will help hot flushes, right? They don't have as much of an estrogenic or hormonal impact, but they will cool down the liver, they will cool down the body, they'll balance the hormonal metabolism that way. So yes, that's wonderful support. But again, you need to know exactly what you're doing. Amalaki is another great tonic, and oops, another great herb, highly rejuvenative. Shatavari is great for Pitta as well, and it pacifies Pitta. Now Ashok, right? Ashok is another beautiful Ayurvedic herb, and I personally don't recommend Ashok to most women and don't prescribe Ashok to all women, because a lot of women would fall into the Vata dominant, especially to women who fall into the Vata dominant category. Ashok has an astringent property and it arrests extra bleeding very, very well. It's great for things like fibroids and growths, right? And as we looked at before, increased bleeding, for example, is Pitta type of feature, right? But if your periods are already scanty, if you're in your perimenopause, early, middle, late perimenopause, then Ashoka will dry it up a bit too much. So I don't prescribe Ashoka to everybody, but if a woman has fibroids and is bleeding very heavily, right, and losing a lot of blood and becoming even, I've got some patients who are becoming anemic as a result, right, as well, are very common. Then Ashoka is a wonderful herb of choice. And that's the way to go. Yeah, makes sense? And another great herb arjuna, right? Is also great for the blood, and this herb has specific affinity for the heart. And so we have, it's 8 o'clock now, so we probably do need another 15 minutes. So just letting you all know that if you do need to go, then go, and I'll send you the recording. Otherwise, we'll continue maybe for another 15 minutes or so. So if you're free to stay, please stay. So we were on Arjuna, and Arjuna has an affinity for the heart, and it wonderfully supports the cardiovascular system, right? And as we know, so with some women, cardiovascular system can suffer in later years, right? So Arjuna is a great support here. And of course, with kapha dominance, we want to detox and stimulate. We want to remove the burden of ama that's clogging the channels. We want to remove the oedema. We want to improve the kidney function. And such beautiful preparation as tricatur is of great help here. But be mindful that tricatur is actually very heating to the body. Ginger, Nava, Gokshura are all beautiful kapha herbs and preparations. And as with most stuff, it's better not to self-prescribe unless you know exactly what you're doing. So this is a snapshot of what's available in Ayurveda in terms of individual herbs. We're not going now into specific practitioner preparations because I would definitely not but a very safe rejuvenative tonics for everybody. Chyawanprash, particularly Chyawanprash with silver, and preparation called Brahma Rasayanam. They both belong to the type of medicines called leham or therapeutic jams, right? And Chyawanprash, they're both actually very tasty to take as well. So Chyawanprash is a wonderful nourishing tonic supporting reproductive health, immunity, longevity, ojas, vitality, youthfulness, and Brahma Rasayanam improves ojas and corrects endocrine system as well. The best way to take them, I've got another question, I'll get onto it in a second. So the best way to take Chyawanprash and Brahma Rasayanam is this, a course of 3 months consecutively, right? With 1 teaspoon in the morning and 1 teaspoon in the evening, and then a break. And you can do that course of 3 months, once or twice a year. That's the best way to take them. Yeah. Now I've got the question, wondering which are the hormonal balancing herbs. Do I recommend any others? I think what I've listed here are the main kind of Ayurvedic single herbs. There are also a lot of Ayurvedic preparations that are wonderful for balancing hormones, right? And these preparations include asavas, arishtas, kashayams, quartams. They would include, but wouldn't be my first choice of herbs for everybody. They would include gritam preparations as well, but gritam should, or medicated ghee should only be used on people with minimal ama, right? In terms of Western herbs, I'm not a Western, not that familiar with Western herbs. I'm an Ayurvedic herbalist, right? But in terms of Western herbs or Chinese herbs, a very efficient herb is wild yam, which has both progesterone and estrogenic activity. There's also another chastity or beets, right? That's been so well researched, and it's also a wonderful support. It has both estrogenic and progesterone effects as well, and it's been very well researched. It's helping out a lot of women, right? And of course, you know, other more gentler herbs that are widely available, such as St. John's wort, for example, in small quantities is very beneficial. Okay. So now moving on. Useful tips for hot flashes. Firstly, have a look at your diet. If you're suffering from hot flashes, taking hormonal replacement therapy, and eating chili and drinking coffee and alcohol, then it's probably not being kind to your body, right? So removing heating, stimulating, pitta-aggravating foods from your diet, like alcohol, vinegars, fermented foods, anything that's heating. Any substance has time and place in Ayurveda, right? Nothing is purely good or bad. For example, a little bit of coffee or vinegar is okay for kapha, pure kapha people, right? It stimulates them, but not at the time of menopause, and specifically not in the time of hot flashes. It will heat you up. So resting well daily, no overwork. It's interesting that Ayurveda sees working with computers, particularly with numbers, as a very pitta type of work that depletes pitta resources of the person, and a lot of us do that, right? So learning to rest. In warmer seasons, a wonderful, wonderful thing that one of my beautiful Ayurvedic teachers, Dr. Ajit, taught was walking on the grass with dew in the morning, right? In warmer months, of course, not particularly right now when it's so cold, but in summer, when it's a wonderful way to cool the body. And the feet have the marmas, certain marmas, which will be activated, and very cooling, balancing, wonderful practice. Another interesting thing is, you might, if you're doing research on what to do with hot flashes, you might come across things like drink icy liquids or very cold liquids. From an Ayurvedic point of view, yes, a cold liquid might give an immediate relief during the duration of a hot flash, which can be completely different intensity for different people, by the way. So never judge anybody else's experience by your own. So while drinking a cold drink during a hot flash might relieve it, in the long term, it will actually make it worse, right? Because it's aggravating to vata. Cold water is aggravating to vata. It will impede your digestive intelligences. So normally try to drink warm drinks. Don't go for cold drinks. During a hot flash, cold local compress on the neck helps a lot. Learn and practice regular pranayama, and of course herbs and herbal medicines are very, very supportive. And as we spoke before, risk and benefit, if nothing else works, and if you're climbing up the wall, then maybe the hormonal replacement therapy, working very closely with a good qualified GP on that, maybe that's the way to go. I find that usually if you address it more and more with Ayurveda and lifestyle, you'll find less and less need for it. But everything has its time and place, yeah? Now, we will talk about, we're almost towards the end, so we will talk about the Panchakarma and Rasayana practices that Ayurveda recommends for women. Panchakarma. Pancha means 5. Karma means actions, right? 5 actions. Nowadays, Ayurveda used to be a complete medicinal system many thousand years ago. Nowadays, it's practiced mainly as a complementary medicine in the Western context, and Panchakarma, heavy-duty detox therapy, right? So the 5 Panchakarma, so Panchakarmas are mainly done in India. It's the most cost-effective way to do Panchakarma is in India, under the supervision of Ayurvedic doctors. You can also do Panchakarma at home, And for some of my clients, I do guide them through a panchakarma process at home, kind of self-home panchakarma, for people who can't travel or for people who can't leave the country. But generally, the most efficient, the most relaxing panchakarma is in a therapeutic setting where you take a few weeks off. So the 5 cleanses of panchakarma works like this. Your body is prepared through herbs, body oleation, and a few other therapies. And then the 5 cleanses are given to your body. The 5 cleanses are cleansing the mucus through a procedure called vamana or therapeutic throwing. That's not done in the West at all. Cleansing the extra pitta, inflammation, acidity, and pitta type toxicity from your system through a cleanse called virechana, right? And a cleanse called vasti or basti is an Ayurvedic therapeutic enema that is done for vata type disorders, to take extra vata energies out of the system. Then nasya, that we spoke about, is part of panchakarma as well, the nasal treatment. And the last treatment of panchakarma is rakta mokshana. Rakta is blood, mokshana is liberation, so that's bloodletting. Nowadays, of course, it's not done, in most settings. The most frequent form of bloodletting now is, in the old days, they used to cut certain veins in certain places and let the blood out. But now it's mainly done either through leech therapy. That's, by the way, wonderful, wonderful, wonderful for female stuff. But not widely practiced. It's very widely practiced, for example, in Russia. A lot of Ayurvedic doctors and other doctors teach it and practice it in Russia, for example. But you know how we spoke before about menses and menstruation, rakta mokshana, blood liberation. Menstruation is a natural form of purification, right? When the periods stop, it's that rakta, the blood, that gets stuck and the heat of the body is circulating. That's where it becomes uncomfortable. Some Ayurvedic practitioners recommend, as a form of rakta mokshana, actually to donate blood on a regular basis. In Australia, you could do it every 3 months. Yes, why not? It wouldn't be the full panchakarma or rakta mokshana, but it would help. Of course, if you don't have anemia or iron or ferritin issues, then yes, that's, that could be a good thing for you post-menopause. All right. So panchakarma is the ultimate Ayurvedic cleanse, right? And out of this, you can take home this. You can do a home mini virechana, which will assist you greatly, greatly with hot flushes and taking acidity out. And it's very simple, but it doesn't taste very well. And it's called castor oil cleanse. You can't take castor oil for prolonged periods of time because it's habit forming. But once or twice a week for 6 weeks, take from 1 to 2, for some people, to 3 tablespoons of warm castor oil in the evening with warm water, and see what happens after. Could be a good way to get rid of extra toxicity in your gut, and alleviate hot flushes quite significantly. A similar way is Avipatika Churna cleanse, where you take 1 to 2 tablespoons of Avipatika, boil it with warm water, and then drink that drink, and that also can act as a mild flush. Right, so if you have digestive problems, particularly inflammations in the gut, suffering from flushes, so yes, you can do it, but don't do it for 3 or 4 months in a row because your gut will become lazy. 6 weeks, stop, right? That's a good an easy home thing you can do. And lastly, Ayurveda has a branch called Rasayana. Rasa means juice, juice of life, and that's Ayurvedic rejuvenation. Prerequisite for that Ayurvedic rejuvenation is you need to herbs. Technically speaking, even herbs like shatavari fall into the rasayana or rejuvenative category, right? Then ghee and other nourishing substances, taking them on a other nourishing substances, like, for example, brahmi ghritam. Oh, my cat is here. Interested in rasayana. Okay. So then considering Ayurvedic rejuvenative body treatments and herbal preparations like lehams and gritams will significantly improve vitality, longevity, and activity all through life, and particularly in the later years dominated by the force of Vata, right? Okay. And last, some crystals that I would recommend specific to menopause. The choice number one, interestingly, is pearls, right? Ayurveda calls the female womb, has a name for the female womb as Garbha or Shanka. Shanka is actually, what's the word? Direct translation of the word Shanka, or womb, from Sanskrit is corn shell, right? Shell. And then I found some interesting parallels, for example, with Aphrodite, right? Who walks out of a shell, and it must represent some, must have some energetic meaning of the female fertility and the female power, right? In some level. Then the pearl, to me, would hold that type of energy, right? Putting the female energy and gaining wisdom and experience through it, as is the pearl in itself, right? So pearls have the quality of cooling, calming, and giving centeredness, particularly for hot flashes. Yeah, that would be my choice number one. And in history and in myths, in Greek myths and all over the world, Sanskrit, Indian, Vedic, pearls are symbolic to wisdom gained through experience. And that's what the postmenopausal years are all about, wisdom gained through experience. Right? And I would like to read a little passage Dr. Svoboda. I don't know if you can see Dr. Svoboda's book, Ayurveda for Women. After menopause, a woman should be sufficiently experienced in life to begin to coach the family team, to mentor the younger women within it by offering advice and encouragement, teaching them her own rituals and vow stories, and generally setting a good example for them. Right? Food for thought. Once one stage or the second stage, Pitta stage of life completes, it's good to redefine the priorities, find some set of purpose, some set of clarity, take time to explore the inner landscape, right? The next crystal great at menopause, very supportive, is the moonstone, and it's associated with inner growth, strength, assisting with emotional stress, calmness, intuition. Another choice, my choice of crystals for menopause is Larima. And if you think of Larima, you can think of the ocean from which the Shanka or the corn shell comes from which the pearls of wisdom come from, right? So Larima is a wonderful cooling crystal, giving facilitating wisdom in my experience, but you can experiment and see what comes up for you. With crystals, you can wear them as jewelry. You can wear them, you can meditate with them if you're so inclined. You can wear them as bracelets. Gem quality jewelry you can wear as rings. You can put them in your house. You can sleep with them, whatever calls your fancy, but I find them very supportive. Another crystal that I love is lapis lazuli, specifically for sleep support and supporting. It's a very supportive crystal during transformation periods, which menopause is. A lot of magical healing properties, so it's great to keep it in your bedroom as well, I find. But you play with it, see what comes up for you. Amethyst strengthens the aura, cools, supports sleep as well. So great general crystal to have. And again, the last crystal, I'm sure there are a lot of other beautiful crystals specific to menopause, possibly even the bloodstone and a lot of others. Golden sheen obsidian, I would like to bring to your attention because it can assist us to let go of the old concepts of ourselves and find the new purpose and the power, and find the new power. Crystals. And ultimately, you know, just in conclusion, and we'll leave a few minutes for questions as well, I would like you to consider, you know, the menopause, not, yes, it is a loss to a certain degree of youth, to a certain degree of beauty, to a complete degree of fertility, right? But at the same time, what do we gain? Do we become the true wisdom holders and turn our own experiences and offer them to the world, or even to ourselves? Giving yourself the oxygen mask first. So I'd like to offer you the Native American proverb. At her first period, the girl meets her wisdom. Through her menstruating years, she practices her wisdom. And at menopause, she becomes her wisdom. And as we know, in the older functional communities, the elderly women largely were holding the wisdom and the energy for the whole community, right? So this is just an inspirational thought for you to leave you with. So thank you so much for your attention today. I hope you learned something useful. Don't try to apply it all if you haven't been already, but try to chunk it up for yourself, apply it in chunks, make it your own, and feel the benefit and the truth of that for you, right? So small steps at a time, but do these steps, because if you don't do the steps, then it becomes a ballast in your life, becomes a mental knowledge meaning nothing. And that's not good. So thank you all so much for your attention, and if you have any questions, just type them up and I'll do my best to answer them. If there are no questions, I will finish, and some people are already leaving, but I'll finish this with a quote from a beautiful book by Dr. Claudia Welch. And I really adore Dr. Claudia Welch. I have met her in person 10 years ago. I've studied with her, and she's my Ayurvedic mentor as well. So I'd like to offer you an extract from her book, Balance Your Hormones, Balance Your Life. I don't know if you can see the book in the video. Ayurveda considers that menopause marks a major turning point for a woman. It is a time of transition when she naturally is suited to begin an inner journey. Up to now in her life, it was natural for her to educate herself, raise a family, develop her profession, and engage fully in the world. Menopause is time to momentum of her involvement in the activities of the world, turn this energy inward and begin to plumb the depths of her soul. It helps if she has exploited this territory already, but one way or another, by force of circumstances or by choice, she now needs to become as comfortable with her inner world as she has been with the world around her. If she hasn't done so before, now is the time to read books written by saints, elders, teachers, and disciples of truth, and to go on retreats designed to support her growing discovery of her own true nature. Which spiritual traditions she pursues may not matter, as long as it resonates with her deepest inclinations and inspires her to a deeper relationship with her true nature. So thank you so much. I've got a question. Is it because it stimulates uterus and increases bleeding? I'm not sure what this question means. Where would you go about getting oils and herbs? I stock the oils and herbs in my Ayurvedic clinic, and I use practitioner-only range. And if you need them, I can post them. Australia-wide and New Zealand-wide. New Zealand, though, with bigger delays. And I would also recommend for you, if in any doubt or with complex or long-standing conditions, to have an Ayurvedic consultation as well. Yeah? Or you can source Ayurvedic products from an Ayurvedic practitioner near you. They're all a wonderful resort. Triphala, I've got a question. In regards to herbs, I've heard that trifle is good for digestion and elimination. Do you recommend taking it every day? Trifle is a wonderful herb. I would certainly recommend taking it, but again, you need to know what you're doing. Trifle is great. Trifle has got tree is three, phala is fruit, three fruit. Amalaki bipitaki haritaki, right? And it assists with digestive tract and elimination. It's great for the microbiome of the gut, and great for a lot of things like diabetes, cholesterol, obesity. It helps with the food absorption, not just elimination. It's a very mild laxative, but it's not addictive, so you can take it for long periods of time, but you still need to take, say, it depends person to person, but generally 4 weeks on, a few days break, 4 weeks on, a few days break. If, however, your elimination is good, and you are very, very, very prone to water, then it eventually can cause some drying. So again, of the gut. So I don't recommend to be on it for a long time, self-prescribed, right? But short time, yes, you can take it, no problem. It's great for the gut. And great for the menopausal symptoms too, indirectly. Trifle has amalaki, that's great for the liver. That will definitely help with menopausal stuff. Yeah. Any other questions? So thank you all very much. I wish you all the best, and I wish you to find the depths of your inner wisdom. Thank you.